welcome to my virtual couch. Happy Friday to you all. We are back with the part 2. Hi, Catherine.
Hi there. Good to see you, Pam.
Thank you. So I really enjoyed part 1. And I got to tell you that I had 2 things. I had a husband send me a message on Instagram and said that he found it very helpful. And one of the things that you mentioned that he did not realize is you said like acknowledging things like the due date, just the different milestones that the mother would have reached. He said that did not click with him. And so he said, he's like, because the pregnancy loss for her happened, I think he said 2.5 years ago. And so he said, like, certain things are making sense that around certain times, she's kind of more withdrawn and isolated. She's like, so I don't know what to do because he's thinking, is it too late to acknowledge? And I was like, I don't think that Catherine would say yes.
Never too late. Never too late. Yeah.
So I said, no, go ahead and acknowledge. And he said, I think I could remember the due date, and I was trying to help him to figure out how to find the due date, like looking at certain documents. But I just want to say, like, that has been, the fact that he reached out to me, thank you so much, because that is now helping him to help her, and he said he even told another buddy whose wife is going through pregnancy loss right now. Because he's like, if I had the tools, right? Because sometimes I feel like they don't know how to handle this. So thank you again for that.
Oh, yeah, you're welcome. Because fathers actually and partners, the non-birthing partner tends to put it in a shoebox in the closet. And when the mom, the birther starts to feel safer and starts to thrive again, then the dads usually pull it down and go through it, and then they kind of fall apart.
Right.
The resources I gave you both have father-specific support groups, and so
I saw that.
And there's another one called Grieving Dads by Kelly Farber, and he is a wonderful father, and it's a different dynamic for these dads.
This time we are talking about surviving and recovering from birth trauma. So, Catherine, in part 1, you talked about having to go through your own trauma, right? Of having going through a stillbirth. So, can you share a little bit more about your story of stillbirth and pregnancy after the loss?
Sure. Absolutely. So my husband and I had 4 children in 6 years. And I guess that's why I joke and laugh and say I'm legally insane, because it was a lot for my body and my emotions and my journey into motherhood to go through. So we had the pregnancies were back to back. And it really put increased a lot of stress on my reproductive system. So in November of 2005, our 3rd child, Helen, was stillborn at full term. And it really just rocked our world. I was about 4 days away from my scheduled C-section, and we were at my sister's wedding. And what happened was the baby, we didn't know it was a girl, her movement increased, which is rarely talked about. Mostly the wives' tales are that babies slow down and run out of room. But what we know is that fetal movements are very vary in differences, and also can increase and decrease, and can be a marker for a baby who's not feeling well. So my OB was wonderful. We found there was no heartbeat, and she asked me to go home for 3 days and to gather my support team, and that we would go back to the hospital and induce me. Helen was, I have a picture. These are her hands. Let's see if I can.
Oh, that makes me very teary-eyed.
Her beautiful hands. A family member sent us a burial gown, and we were able to baptize her in the hospital, and spent some hours dressing and bathing her and getting to know her. And returning home to some toddlers was extremely hard and painful. And I reached out to my pediatrician for how to talk to my children about the fact that their sister wasn't coming home. And it was just a rough couple of months. Wasn't able to access mental health support. There were no support groups in my area. No one checked in on me. My OB saw me at 6 weeks and asked me how the baby was doing. The nurses didn't even recognize that I had a stillbirth. So we immediately got pregnant as fast as we could because I needed to laugh and love again. And so we went on to have a rainbow baby. And that's where I have centered a lot of my work as a therapist, is around decreasing a mother's anxiety after birth trauma during the subsequent pregnancy, and therefore trying to increase attachment, a healthy attachment style to the rainbow baby.
Yeah. Katherine, what was that drive like when the doctor's like, you have to go home? And I'm assuming you went to the appointment by yourself, but when the doctor says you have to go home and talk to your support system, what was that drive home like?
Ooh, honestly, it was quite painful. My husband was out of town on business, and so he rushed home and picked me up at the doctor's office. And we went home, and my sister flew in from Texas, and we had support with helping take care of the children while we pulled together a plan. But waiting those 3 days was the biggest gift that Dr. West could have given me, was that it gave me time to move from shock into I don't know, more shock. But it allowed us to put some supports in place to have the most optimal environment for making memories.
Wow, Katherine, that is, I want to ask a little bit more about that. What do you think it took for you to, because that's a trauma you never get over, right? But how were you even able to be resilient through that?
It was really rough in the first couple of weeks. My mom pretty much came over every day and took care of me. We sent the children to preschool, and I stayed in bed a lot. I cried a lot. My mom made sure that I was eating and drinking. But eventually I had to return to life. I owned my own manufacturing business, and we made children's clothes. So someone had sent us a burial gown for my daughter, and it never occurred to me that people would need burial gowns. So ultimately what we did was I closed my manufacturing business, and I started making burial gowns at home. And so to this day, I still make them. And
really? Wow.
And I donate them to the hospital every year on her birthday in honor of her.
What a way to honor her memory.
Yeah.
That's amazing. That's a beautiful story.
Thank you.
Wow. You talked about attachment styles earlier, and that's actually on my list of video to make, right? So how would you say the attachment theory supports mother in a pregnancy after infant loss?
So our psychologist John Bowlby talks about how, as parents, we react to loss in four attachment phases. We first go through numbness, yearning for our child, disorganization and disrepair. We really start to fall apart, and we're trying to make sense out of this. And then ultimately we get to a point where we're able to reorganize our thoughts and our attachment styles. And we come to accept the loss the relief is typically during that first stage of numbness and yearning. It's important that note that these phases and feelings don't always happen in order. It's like a big hot mess. Grief is not linear. It is I like to describe it as a ball of yarn. It's a ball of yarn with a bunch of knots. And the stages overlap. And the theory also suggests that infants will develop their emotional attachment to their primary caregiver. This is why attachment during the subsequent pregnancy is so important, because in getting pregnant after a loss, we have already lost the hope of the dream, the world that we assumed would be that we would have a baby and come home with a baby. And so bonding with the child during the subsequent pregnancy over the weeks and the trimesters can really help strengthen that bond when the baby arrives safely.
Yeah. Sometimes I have some mothers that feel like after with the rainbow baby, it's hard to form a healthy attachment because there's a lot of comparison.
Yeah.
Obviously the rainbow baby can't replace the loss, but sometimes it's difficult. How do you talk to mothers about that?
So what it happens gradually. So in the first couple of weeks of being pregnant, in the subsequent pregnancy, we tend to just stay in denial. And I think that's part more of that numbness of just being numb, being in denial. And we're really kind of counting the weeks until we hear a heartbeat, till we see the heartbeat. A lot of moms in that subsequent pregnancy really hold their breath until the anatomy scan, when we know that there's 10 fingers and 10 toes, and that things are going to be okay. And depending on what time of what stage of gestation our loss was, we often hold a lot of anxiety around that date. So for me, Helen died at 38 weeks. So until I reached 38 weeks with her sibling, I was in denial a lot of that time. But what we're trying to do in pregnancy after a loss is help these moms get to know their baby, sing to them, talk to them, take them places, have a baby shower, celebrate a World Series or some type of major family event, take lots of pictures. Just because you're pregnant doesn't mean that your baby isn't living inside you and experiencing all the joy.
Yeah. I always tell pregnant moms, like, babies can feel the infant, they can feel your energy. They really can, right? So if you're like, whatever you're going through, they can feel it.
Yeah.
So Katherine, can you talk about the anxiety and the depression that comes with the loss?
Yeah, the loss of a baby during a pregnancy is estimated to be around 30% of all pregnancies that end are unexpected and sudden. And this is a traumatizing experience, regardless of the cause of the death. Anxiety and depression are going to come naturally with a subsequent pregnancy, and families all handle it differently. But for a mom to be able to say, this is making me nervous, this is making me uncomfortable, and I just need to name it and rationalize it, to be able to just soothe the system and understand that this is a natural process of connecting and attaching to their baby. So just as anxiety during a pregnancy brings in a lot of fear and depression, it's also that your amygdala, that warning system of protection, of thinking, well, is my baby okay? Do I need to know my baby better? It's similar to intrusive thoughts that we sometimes have after pregnancy. Intrusive thoughts are not always warning signs of SI or danger or psychosis. They're warning signs that you sense danger and that you want to do something or know something that's going to help your baby be safe. So I like to help my families recognize that even though they're feeling anxious, it's because it's their body saying, you need to get curious about this. We need to learn what you're feeling, why you're feeling it, so that we can name it and normalize it. Because it could be a good warning system that your baby doesn't feel well.
Yeah. Okay. And can you tell me more about what moms can expect in the subsequent pregnancy or themes that you've seen?
Sure. So they often view the loss as a significant life event possibly even very traumatic. They have a sense of isolation and loneliness due to the stigma of the silence and just death around. No, babies aren't supposed to die. We also feel invalidated by our friends and family, even though it's not intentionally. We feel shame. We feel shame and fear that we were not able to be the good mother and keep our baby safe.
Yeah, a lot of blame. This is where I'm going to share my own personal journey that I also suffered a pregnancy loss, miscarried very early on. And what you said really hit me, which is like, I felt like my body has failed me. Right? Like I'm supposed to, like a lot of personalization, like blame, like I'm supposed to keep this baby, healthy, and what have I done? And I remember like the therapist's brain in me, right? It's telling myself, that's not rational. But the human brain, the non-therapist brain, is going down this, and I know those mothers do this a lot, going down this rabbit hole of, I needed answers. Nobody's telling me why I had this miscarriage. Somebody give me an answer. And it's one of those things where we don't know. It's like genetics. And things have to make sense. And so I think that also contributed to the trauma of the loss, because I didn't have an answer. Like, why did this happen?
Oh, I'm so sorry. And thank you for sharing. Thank you for sharing. It's the anticipation of being a parent. We're so excited, and we've been planning to be moms for a long time. And we do. A lot of families that I work with, especially early losses, but even more so sometimes in late losses, is we do want an answer. We want to know, was this, and that's why genetics can be really helpful, and testing can be important. And if you have multiple early losses, because if you work with an endocrinologist, you can really find the answers of what is missing that would help this baby stay healthy and prevent. Stillbirth is preventable, and that's been my crusade for the past 20 years, is to let families and parents and even obstetricians know that we do know what some of the common denominators are for preventing stillbirth.
Can you talk about that a little bit?
Absolutely. So,
because that's something I did not know.
Yeah.
That is preventable. I'm just thinking these are things that happen.
Right.
So, yeah, I'd like to talk about that.
Okay. So there's basically 3 different factors. And when those 3 overlap, you have a higher incident of having a loss, a stillbirth loss. And so it's usually one of those is the environment. It's the placenta, it's the uterus, it's the nervous system. There's something in the environment that is causing this womb to be vulnerable.
The environment of the womb. Okay.
Yeah. The other is the genetics of the baby. So there may be something genetically that is causing something to not line up right. And then the third, of course, is the mom. And it could be hypertension. It could be diabetes. It could be stress. It could be many things like HELP syndrome or cholestasis. So there's all of these things. When a mom has 2 or more of these things, we have to really slow down and look. There are things like measuring the placenta to see if there is a growth restriction. I want to talk about counting kicks today, because movement is huge. You heard in my story, she increased her movement. So what I often tell moms in pregnancy after a loss support group is know your baby. When you're sick, when I'm sick, I slow down. I get a ginger ale. I lay on the sofa. I curl up with a blanket. I don't move very much. I slow down. When I get really mad or sick, or I step on a Lego, I get mad. I try to get somebody's attention, and I start moving fast and furiously to to cope with not feeling good,
Mm-hmm.
being mad. And so when babies slow down, they're trying to tell us something. When babies speed up, they're trying to tell us something.
Mm-hmm.
So counting and being aware of your baby's movements can tell you how your baby's feeling, which then leads you to say, hey, doctor, this A, B, and C has changed, and I feel like we need to look and see what's going on.
Mm-hmm. Mm-hmm. Yeah. Thank you for sharing that. I think that's very helpful. Yeah. So as a therapist, how do I support these moms in this stressful pregnancy? I have the one client in mind I talked about in part one, where she's pregnant and she had a miscarriage. And when you talked about counting kicks, we actually had a session where she's near the end, I would say like, yeah, near third trimester. And the doctors, now they're talking to her about counting kicks. She doesn't want to count the kicks because it's too stressful for her, right? But that's one of the things that's important. So how do I support, or as a therapist, how do I support the moms going through a stressful pregnancy?
Oh, you just remain present and focused and engaged with what she is experiencing, and normalizing that. Sure, I would imagine that you are nervous and anxious about every movement, and how do you connect with her to help her feel better and integrate her personal alarm system that is trying to make sense out of, is my baby going to be safe tomorrow when I wake up? And so that's why I really love Count the Kicks. So you can go to countthekicks.org and you can download an app, and it is free. And I've heard from moms who are anxious that having that set time a day to touch the little footprint and count their child's movements gave them the confidence that at this moment everything is okay and I don't need to get curious about anything. My baby is moving normally. So let's just say 12 is your baby's normal movements in 10 minutes at a certain time of day. And weeks go by and you're getting 12s, 11s, maybe a 13, but your baseline is 12. If you one day you're not feeling good, your baby's not feeling good, and you get 7 movements or 6 movements, that's a big change from 12. So that would be a good reason to call your doctor. Or in my case, if you were getting 18 to 20 movements, be a real good reason to call your doctor and say, my baby's movements have changed. Moms have a sense that they are in control of being being present with their baby.
Yeah. Yeah. I mean, at this point, you know your baby better than anybody.
Yeah.
Yeah. So that's important to look at. Yeah. So in the same question applies, how do I support a mother dealing with birth trauma?
So it's, I guess, demonstrating acts of care, helping her feel committed to bonding and connecting with her baby, even though they may have had a traumatic birth experience and she didn't have the delivery that she had expected or that she had preferred or planned in her birth plan. I like to just really sit with them and ask them to tell me their story over and over and over again. Again, it's that, tell me how you would have liked your birth to have gone. What would you like to have done differently? What would you do differently next time? Because what we're doing is we're giving voice to their experience and how they would have preferred it to have gone, or they would like to go back and redo. Somehow, in being able to talk about it and for them to be able to explore that they did everything in their power that day with what they had was exactly what was needed, and that they are not at fault for things not going as planned.
Yeah, and that's something that I had to tell myself too. Why is the bond or attachment vital to the mom during the pregnancy?
The mother-infant relationship is the most essential and significant process in the postpartum period. This relationship is comprised of a complex interplay between becoming a mother, being a caregiver, and learning how to regulate our emotions as women and mothers. And it's a I like to say it's a cognitive appraisal of concert when you're signaling how to care for your baby and get to know your baby. So it's this beautiful dance. And um, it's your baby's eyes, their cries, their sense of touch, and how they respond to our heartbeat. It's how they respond to the touch of our skin or the sound of their father's voice. All of these things make your child feel safe, feel loved. They don't have to fear that they're not going to get fed or that they're not going to be warm or safe. And all that's why the fourth trimester is so vital to a baby's development. And it's vital to the development of a mother as well, because if you're not able to do those things for your infant, you feel less validated. You don't feel important. You feel like a failure, and all those things that undermine the good work of becoming a mother.
Yeah, yeah. For those who may not know, how would because and somebody says, "What's the fourth trimester?" I don't think we talked about that. Can you explain what that is?
Yeah, it's a new term. It's the first trimester. The fourth trimester comes after the third. So the third trimester, you go to the hospital, you have your baby, and you go home for the fourth trimester. It's a time of nesting and bonding and laying in bed and sleeping and eating and nursing and just resting and recovering. Your baby is growing, your body is healing, and honestly, laundry can happen later. Dishes can be done later. Having a plan for who's going to care for the mother and so that the mother can care for the baby is vital. And it's some of the most special time with your infant that you don't want to miss.
Yeah, I love that. This is coming into my head. How do you deal with when you've dealt with a pregnancy loss or birth trauma? And how do you deal with the external factors around you? So like you've been invited to a baby shower, you've been invited to a birthday party, right? Like for me, I had to pause on that for a little bit, right?
Absolutely.
How do you help support moms that, or like sister is popping the babies out and you're dealing with that, or a friend is, how do you deal with that?
It's such pressure. It is such pressure on the woman to show up and be that well-rounded, well-coping woman that she's used to being, and she's not feeling that way. So whatever you have to do to unplug, turn off your social media. There's algorithms written that'll help you reprogram Instagram if you have lost your baby, so that you don't get all of those reminders that are triggering. Support groups are really helpful in learning how to sit with your sister or your cousin who is constantly able to produce babies and you're struggling with IVF. It's okay to protect yourself. And I like to help moms come up with an exit strategy of, how do I get out of the conversation? How do I get out of the baby shower? How do I get out of the Christmas or holiday dinner with grace, knowing that this is just not my year, because Jennifer is going to be there with her newborn.
Yeah. Yeah. And I tell moms to give yourself permission to not go to everything right now.
Absolutely.
Yeah, like I had to say, I can't do that baby shower, I can't do that baby party. Like I need to grieve, you know. And I also find like the support group that's very helpful for me. I found that connecting with a family member that has dealt with pregnancy loss was also very helpful.
Yeah.
You know, in addition to the support of my husband, but
Yeah.
you know, having another woman identify with your loss and pain was very helpful.
Yeah.
Yeah.
Yeah. I was going to say, and reaching out to that mom that said, even if it's just a text message, it says, "I'm really happy that you're having a shower. I'm sorry I'm not able to attend this year, but just know that my thoughts are with you on this day."
Yeah, and I tell moms 2 things can happen at the same time. You can feel happy for your friend who's just given birth and still be sad in your situation. Because sometimes moms will say, I feel really, really bad, or I feel like I'm a bad friend or not a good sister, or, you know, because I'm not supporting them. And I say, you're grieving right now. It's okay to not do those things. And I feel like women are often understanding, you know,
They really are.
hopefully. Yeah, where they'll go, okay, that's fine. And there's been times where I've had like an event and someone was very vulnerable and reached out to me and said, I'm really not in a social mood right now.
Yeah.
Of course, I'm a therapist, so something different, you know, I respond differently, but I'm like, yes, that's totally okay. Take your time. What do you need? That sort of thing.
Well, and I think as a society of compassionate, emotionally aware individuals, we have risen to the occasion where, especially in this day and age, it's okay to say, you know, my health and wellness are really important to me, and I don't think I can make that event.
Yeah.
And bowing out with grace.
Yeah. Well, this has been very helpful. You've given me a ton of resources, so I'm going to put it in the description box. And any last minute tips or tidbits that you want to share?
No, just everyone, the holidays are coming. It is really hard.
Yeah.
And just being honest with yourself and the people that love you, and advocating for what you need.
Yeah, and setting boundaries with yourself about how you're going to deal with the holidays. Holidays are always tough when dealing with trauma. Thank you so much, Katherine. Again, another good one. This has been very helpful. Thank you for all the knowledge and resources.
Absolutely. Have a great day.
Bye. Take care.